To the next question, and which of following is the most likely diagnosis? He's asking about the diagnosis. A 9-year-old girl is brought to the emergency department due to prolonged epistaxis. Prolonged epistaxis, age of the patient is 9-year-old girl. The girl says that she picked her nose immediately before she bleeding started. Her parents decided to bring her to emergency department after the epistaxis persisted for the 20 minutes despite the constant compression of the nasal alley. Uh, the patient has had frequent nosebleed that often last more than 10 minutes. Mean till this, the examiner is just mentioning again and again about the nosebleed. Okay. Her family history is significant for a grandfather who had an unspecific bleeding disorder. Family history is also positive. Family history is positive. Given a history of prolonged recurrent nose bleeding, laboratory tests are ordered and the results are as following. Female, age is 9 years, nose bleeding, family history is positive. Three things till now. Hematocrit is 43%, normal is 45%, so not a big deal here. Bleeding time is high and partial thromboplastin time is a high, prolonged. Prothrombin time is normal, thrombin time normal, D-dimer normal. So always remember one thing in your mind, that if any patient present to you with complaint of persistent bleeding and family history is positive, and upon lab investigation there is mention about the two things, the APTT level is also elevated and also the bleeding time is elevated, then what is your diagnosis? We will say that the diagnosis of this patient is a von Willebrand disease. Why it's a von Willebrand disease? Because in the von Willebrand disease, the von Willebrand disease basically protect the factor 8. Factor 8. So in von Willebrand disease, when the von Willebrand factor, the other name of the von Willebrand factor is a desmopressin. So in von Willebrand disease, desmopressin will produce less. When desmopressin will produce less, factor 8 will not be protected. When factor 8 will not be protected, there will be the problem with the factor 8. So when there is a problem with the factor 8, there is a deficiency of the factor 8, so the intrinsic pathway value will be high, APTT will be raised, number one. Number two, when a person have any blood vessels injured, the platelet first it's bind with the von Willebrand factor. Now in the von Willebrand disease, von Willebrand factor is absent. When von Willebrand factor is absent, then the platelet will be able to bind with the von Willebrand factor? No. When von Willebrand factor will not bind with the platelets, so we'll see the bleeding time of the patient will be increased. So in simple words, if you see any question, the bleeding high, APTT is a high, and with this the bleeding time is a high, even the platelets are normal, the qualitative disorder, we will say this one. So the diagnosis is a von Willebrand disease. So we will choose the von Willebrand disease. This one is the right answer.